If the pain is in this immediate area, chances are it's not muscles, because there's no muscles right here. So that's a safe place. That if the pain is right here, it might be caused by muscles, but is it muscle tissue hurting? Probably not. And in most of our body, right where we cross a joint, there's not a lot of muscle tissue. So muscle pain is going to be in the belly of a muscle, in between the joints. There's a few exceptions to that. There are some things that cross joints that are muscular. But in the knee in particular, if the pain is right around here, it won't be muscle pain, but it might be tendon or it might be ligament. And if it's tendon, it's about what the muscle is doing, and it's about what the bone is doing. And if it's ligament, it's about what the bone is doing and about what the muscle is doing. So some things we don't know. If it's right on the edges and it doesn't feel like it's inside, it might be lateral or medial collateral ligaments. So there is a like, if it's on the surface, sometimes the question is to kind of sort out what the pain is, or even actually what the sensation is. So is it an achy thing? Is it a sharp thing? Is it a tingly thing? Does the sensation come when you do something? Does the sensation come after you do something? Like, those are going to help you sort out after a while what it is that's going on. And sorting out all those things is a little bit more than we can do in this class. But if it's inside and it feels like, now the meniscus itself doesn't have a lot of innervation. So when the knee locks up, and it doesn't hurt, but it gets locked up, that's often a meniscus thing. But it doesn't mean that someone's meniscus won't hurt. It's just that most people that report pain when it's a meniscus thing, report that locking up and it turns out to be some issue in the meniscus. It's not a lot of sensation, it's just an inability to move. Except for when there's really sharp pain with it too. And it could still be meniscus. There's a kind of pain that's a bone pain, that's an ache, that's this arthritis, wear and tear. I don't know how to describe it, but except for that it's different. It's in the bone as opposed to in the cartilage. That's maybe deeper and achier, but then there's also some places where we can get some really sharp pain, where people get these pains on the inner edge of the knee and here, or the pain could be up here on either side of the patella. So if the pain is around where the kneecap is, it could be a patellar tracking issue, which I'm going to come back to in a second and talk about that. Pain there. But in a way, all of those pains, all of those things, if someone comes to me with any of those, I'm still going to say, where's the weight traveling in your leg? And is it still traveling clearly as you do this? And oh, it hurts now when I do this. Okay, where does it hurt? But I'm going to go back to it. I don't need to know. I want to know where their sensation is, because it tells me something about what the movement is. But it's also in what movement does it happen? Or if it's an afterwards thing, what were they doing right before that? Where was there a lot of movement? Where was there not so much movement? With what we know about how movement balances out, if there was a lot of movement where we don't need any more movement, then maybe we'd do less there. Right? If there was a lot of and find movement somewhere else. Yeah, so it's kind of a non-answer, and you can get really detailed about it, but I think in the long run, for the help we can do, the thing that's going to be most helpful is what were you doing when it hurt? And where is the pathway, where's the organization not clear? What's happening below it, what's happening above it, how do things move through, and how can we clarify that?